And we have another amazing guest with us today at our never-ending series of interviews during the conference of Langa. Our guest now is Kристоф Перрин, who is he's with MSF. First of all, my head is getting crazy by the end of the third day, and he's a pharmacy advocacy for say it again. Now you say that.
Actually, I'm TB advocacy pharmacist for MSF Access Campaign.
TB advocacy pharmacist, not the pharmacy advocacy TB. Yeah. Any scientific breakthroughs that struck you?
Well, being the pharmacist of the NTB project, of course, I'm really glad to see 10 years of work that have been shared with the TB community on Wednesday about the NTB trial outcome. So that's for sure something I was very glad about. But of course, happy also to see the strong TB result about fluoroquinolone, levofloxacin that can become an option to prevent DRTB for household contacts and especially children. For DRTB, I found that fantastic. There's so much to be done still for the kids around TB. Just to think that comes to mind.
Yeah, and using this opportunity, as you mentioned, NTB and everybody who we interviewed, of course, we're talking about NTB. Please accept our congratulations. This is an amazing work and a real breakthrough. And to you and the whole team who was involved, researchers, scientists, you guys did the best thing possible.
No, thanks. Well, and I'm just the apothecary of the team. So I was just here to make sure the drug would be available and to try for the price to decrease by the time the outcomes of the trial would be out. And at least for bedaquiline, we did not do that bad.
Yeah,
thanks to a very big collaborative work.
Yeah, we started to talk a little bit, but maybe you can unfold. Like, how long have you been with MSF at all, and what are your specific roles in your position?
So I started with MSF in 2005. So it starts to be some time ago, and with different positions, but as TB advocacy pharmacist, has really started to work at that position for MSF Access Campaign in 2013, so it's a bit more than 10 years ago. And basically, the objective I've been since for the past 10 years to try to have repurposed medicines like clofazimine, fluoroquinolones, linezolid, to see their price going down, ensuring quality assured, of course, generic versions, and at the same time, the newer medicines, bedaquiline, delamanid, pretomanid, the same, just so that any regimen built with those medicine, all over regimen, short regimens, would be affordable in as many countries as possible.
How do you assess the progress for the last 10 years with this regard, and for maybe other parts, like not only from the pharmaceutical perspective, access perspective, but from the political perspective? Are we getting there?
So if we just start with the, let's say, really pharmaceutical part, linezolid, the price went down 3,000% down from 2013 till now, which is completely amazing. But of course, it's not thanks to MSF, it's just a collaboration of many people, and allowing actually the Global Drug Facility to set up LC competition throughout manufacturers. So at least there's a major breakthrough. And of course, to see the bedaquiline price coming down from $900 for 6 months treatment in low and middle income countries, 3,000 in middle income countries back in 2014, and we are now at 122 for 6 months. That's really something for sure. And that means that we come from a time when a DRTB regimen was costing around $5,000 10 years ago, and now we are around $400, $500, which is, of course, a massive achievement, meaning that with the same amount of money, countries can treat as many more patients, actually, and even with a lot better regimen. So at least here, it doesn't seem so when you work on a daily basis on that, but when you look really across a long time frame, things are progressing. Politically, we are still looking for more money for TB. Still, it's so unfair that the deadliest infectious killer is getting so little attention internationally, or not the level of attention it should have, especially considering what happened during the COVID time. But things are still progressing in an area where I hope politically we are moving towards something that will be a lot better towards people affected by TB and any countries with high prevalence of TB, is the fact that anywhere public and philanthropic money will become available and is available, it will be linked to access conditionalities to private corporations. So having to fight 10 years for lower price for beta-choline, hopefully that price trade. And in the coming months, years, we'll have these elements, let's say, taken in charge upfront by the time contracts are set between private corporations and public entities providing funds, so that we don't have to clean the mess the way we did in the past years. But it's a very naive and idealistic
no, but
view. But
I think that's how we have to perceive this and look at this for keeping ourselves sane.
I agree. I completely agree.
From your experience and from your global perspective, how does the Eastern Europe and Central Asia region look to you?
Actually, considering the high burden for the RTB, the really challenging comorbidity with HIV, with Hep C, in many of those contexts, I'm completely amazed by the progress is made, for instance, in contexts like Belarus, even in Ukraine, in the dreadful situation they are in since 2014. And despite that, they managed to do so many improvements in how people affected by TB are providing care over there, to the point that Ukrainian refugees in the EU were just showing to the EU how badly TB care is organized there, where people have to be closed during 2 years in a room without seeing their family. It's still the standard in Poland, in Slovakia, in the Czech Republic. Two years treatment, injectables, all drugs. And so what Ukraine managed to achieve is just fantastic. And you can go across, you look at even Uzbekistan, even, let's say, the poorer country in the region, Tajikistan, Kyrgyzstan. When I look at what, in collaboration with MSF, the National TB Program, in terms of access, providing access to care to children affected by TB in Tajikistan, that's just amazing. They're one of the countries using more child-friendly formulation for the RTB. And it's Tajikistan with all the rest of the challenge they have to face. So to me, amazing. Also, politically speaking, despite the fact that in many of those contexts, we all know that it's not an easy situation, and you know that even better than I do. I'm amazed about the active role of civil society organizations managed still to have in those contexts. And let's say that around the J&J story, recent story and advocacy time, having civil society organization letters signed in Azerbaijan and Moldova and sent to J&J publicly, having even on the more, let's say, classic side, head of NTP in Ukraine, head of NTP in Belarus sending a public letter to a private corporation in the US. That was never seen. We could have seen things a bit similar for HIV, but in TB, ever. So to me, despite incredibly heavy challenges, I'm absolutely amazed how those countries managed to change already a lot of things in recent time, actually, for people affected by TB.
That's really pleasant to hear, because the region is being criticized a lot, and activists inside the region are used to, of course, not being satisfied and pushing governments for more. But I think that's a very valid and important thing to mention, to celebrate the successes that are there.
And even in the Russian Federation, when I see what MSF managed to push as operational research, and clofazimine might enter the guidelines now, and it was something we pushed to have clofazimine registered at the Russian National Regulatory Agency, and more. But of course, there would be so much still to improve for people in the Russian Federation. But that's
there is a question I cannot help but ask about the Russian Federation. You definitely have come across the molecule that was probably 10 years ago, appeared in Russia. I won't be able to say the international non-patented name, but the name is perclozone. And it never flew internationally. Just for some people who maybe in Russia are being treated with this molecule because it's being used. It's being used, not very widely, but it's there. What would you say, in terms why people are not using it all over the globe? Why didn't it fly?
Actually, but it's only what I managed to see, because we have colleagues working in the Russian Federation, and I try to understand a bit the challenge has been that the evidence generated around this molecule in the Russian Federation through clinical trials, the way they've been perceived actually, and compared to other evidence available for other compounds, it seems that there were a disconnect. And that's why, at least I see that physicians in their, at least at MSF, never really managed to believe that it was meaningful to invest efforts so that we could even use this compound as operational. But it might be often sometimes the disconnect between researchers in the Russian Federation and researchers outside. The bridges are not that these many, and perhaps there's probably some miscommunication that happened. But unfortunately, from what I heard, the evidences that went out from the Russian Federation and that we could look at was not, let's say, in comparison to other compounds what have been generated in terms of evidences, it does not match actually the same level. That's what I heard.
What is the most disappointing thing for you today in the world of TB? Like when I ask this question, first thing that comes to your mind?
Well, the fact that we are still missing so many of our people affected by TB. It's just thinking that only a third, and not even, I think it was a little bit less in the last WHO Global TB report. Less than a third of people affected by the TB are being diagnosed and put under treatment. That's just mind-blowing. Then the kids, it's not even, not even, if I'm correct, it's someone told me something great. If each finger are 250,000 kids, it seems that every year there's 1 million kids, 10% of the whole population affected by TB that are becoming sick with TB. And it's only half, of 1/4 that are diagnosed and put under treatment. So it's 125,000 kids, which is dreadful to consider. The rest are not diagnosed. And if I got that well, 50% of those kids not diagnosed, not put under treatment, are just dying. And it's mind-blowing.
What do you
think?
In
the negative sense.
What do you think has to be done to get there, to overcome those things? What should be done by activists, governments?
Definitely, well, activists, what we, with a lot of other activists, and ITPC is definitely part of that, is this effort is really to raise awareness about the fact we need adequate diagnostic tools for kids, because we all know that unfortunately generating sputum is very difficult for most of the kids. And it was very interesting to hear about the Speed TB program funded by United, where they try to diagnose kids in another manner with gastric aspirate, if I'm correct, and there were even another one, just that we can't still have that. And of course, there's the effort to use tool in Gene Expert, but we need adequate diagnostic tool for kids that will be just on a tongue swab, even better than a drop of blood. But that's an immediate effort that needs to require a lot of funds and R&D effort for sure. That needs to be overcome. It's just impossible to imagine all those kids dying for something, a disease which is curable, and for which we have every single child-friendly formulation for TB available since a few days back, because now we have a 150 milligram rifampicin dispersible tablet, which got Global Fund ERP status. So it means now, except pretomanid, for every single TB drugs that are recommended by WHO, we have a child-friendly formulation. So TB is curable in kids. We need to find those kids and diagnose them.
I love the passion. That, everybody who is sitting here with whom I was talking are so passionate people. I love that. I mean, because sometimes in the working routine, like when you do the paperwork, or when you consult people, you deal with death and all these stories, personal stories. You get tired, you burn out. But this is why these conferences, despite of the agenda and program and everything, that's why they inspire me. You get to meet and get an energy from people. I just love that. And thank you for this. What should be our treatment access targets for the next 5-7 years?
Well, I will go back to what I was saying at the beginning. My hope is that the effort that ITPC, a lot of other civil society organizations, MSF, is putting in advocacy to have every single compound necessary to treat TB at an adequate access condition in all the countries where they need them. I really hope that if we get public funders, philanthropic entities setting adequate access requirements at the time they negotiate contracts for co-development of new drugs with private corporations, that in the next 4 to 5 years, as soon as a compound reaches market entry, it has the right price, it has the right formulation, it is registered in all the countries where this medicine is needed, there are the right amount of this compound manufactured worldwide through transparent voluntary licenses signed by the innovator company, etc., etc., so that we don't fight 10 years like we had to with bedaquiline, so that now this compound ends up being a lot more affordable compared to what it was, and hopefully available a lot more compared to what it was. That's really what
I think it's a great target for the activism and the activists. What does activism means to you? What is it?
Activism to me is stand up against something that is not just. Injustice is just not bearable, and we can't accept human barriers to TB care, for instance, or access to care that are generated by human beings. That's just unacceptable. So activism to me is just saying no to that.
And what does it take to be an activist?
It's making life intense, but probably I don't know whether in terms of life expectancy, I don't know whether how many years we might be losing at the end of the road, but at least the path would have been worthwhile. So what needed to be done would have been done. So even if it means going to rest under the ground earlier than anticipated, never mind.
Christoph, thank you so much for your time. Appreciate that.
Thanks, Denis. Thanks to you.
Thank you, guys.
Thank you.